Good evening, everybody. The EU Knowledge Center on Cancer, KCC, it is a virtual center that is led by JRC. It was launched end of June this year. It is a part of the Knowledge for Policy platform that we also host here at the JRC that aims to bridge the science and policy gap. To explain maybe more about the Knowledge Center, it is built on our 4 scientific competences, which is cancer prevention, cancer information, cancer guidelines and quality assurance schemes, and rare disease registration. So what we do is we basically provide IT systems, gateways, portals, databases, platforms to support policies for cancer prevention, early detection, and improved care. To give you some example on our collaboration with the cancer plan, we will take part in the update of European Code Against Cancer. We will also support the new EU cancer screening scheme with our guidelines and quality assurance schemes. So I would say overall, the unique role and the vision of the Knowledge Center on Cancer is to foster coordination and alignment between all of these activities and initiatives, mainly to avoid duplication in the efforts in the EU fight against cancer. There are some bottlenecks definitely in the fight against cancer that we can help to support. And first of all, still striking inequalities are observed in cancer care among European regions and countries. So our technical support with the cancer guidelines aim to address these inequalities. We are also contributing to the setup of the Cancer Inequalities Registry. That is a tool to monitor and report on, as well as highlight the potential disparities in addressing cancer prevention and care across Europe. Another possible bottleneck is prevention. We know a lot about the risk factors for cancer, but now it's time to implement effective policies that will improve people's health, but also to evaluate the effectiveness of these policies. And for this, we need a timely provided data on cancer and incidence. So here come our competences on the provision of cancer statistics through the European Cancer Information System, and information we provide on effective policies through our health promotion and disease prevention knowledge gateway. A gateway that compiles evidence-based information, including health-related policies on cancer risk factors, associated conditions, and now expanding also to include information on different cancers. The national cancer registries and the Knowledge Center have been already working together for several years. The JRC, now under the umbrella of the Knowledge Center, hosts the Secretariat and provides support to the European Network of Cancer Registries, which is a network of over 150 population-based cancer registries in Europe, including the Dutch Cancer Registry. The contribution of the cancer registries, I would say the most importantly, they are the producers and providers of the data that is used to compute our European Cancer Information System estimates for the efficient monitoring of the cancer trends in Europe. Our role as the data broker in this regards is that while using this data, we give the visibility to this work done by cancer registries, but also link it to policymakers. The challenges now we are facing is to enrich the EKIS data with some additional information, for example, clinical information, to geoposition the data, and link it to demographic, environmental, and other related data sets that could in the future support more targeted cancer prevention. So what are possible rooms for improvements? First of all, I would say the harmonization and comparability of the data as well as the increasing completeness of the data that is collected, addressing the timelines of the information collected, as well as the population coverage. Cancer registries are the official source for monitoring of cancer burden in a population, so their data should also play a major role in evaluating the effectiveness of preventive interventions against cancer, but also on monitoring of the progress of national cancer control plans. So I would say that cancer registries are not only providers of the data, but very important stakeholders that maybe could also engage in communication of the knowledge we have. For example, by disseminating the European Code Against Cancer, which is a set of 12 actions that we, citizens, can take to decrease our cancer risk.